Welcome, everyone. So it looks like we do have a few more trickling in, and I'll let them in as we go, but I think we should get started. So for those that don't know, my name is Bianca. I work with the MenEngage Global Secretariat, and I'm from South Africa, but I'm based in the Washington, D.C. area. And we're really happy to have you all here today. This is our first session of the peer learning sessions. So it's been something that we've been thinking of doing for some time, and so we're very happy to be starting them, and we're grateful to have Tearfund with us today, who will be leading us through the first of these sessions. So this is what we've got going today. We have the Tearfund joining us, and they'll be sharing a presentation. Just a reminder that the peer learning sessions at the moment are focused on gender-based violence and violence generally, and we're looking at the sort of the purpose of these sessions is to be looking at promising practices, impacts, outcomes, lessons learned from the actual practice of the work that we're doing. And we are doing this in collaboration with UN Women, who are working with us on the SGBV project. So without further ado, I'm going to hand over to our presenters for the day. Uwezo, over to you, and I'm going to stop sharing so that you can. And welcome again, everyone.
Great, thank you, Bianca. Hi, everyone. As Bianca introduced us, we are going to present about Tearfund experience, about the Tearfund's approach to gender equality. And I will not be alone. We are presenting with my colleague Luke. So my name is Uwezo. I'm the Global Transforming Masculinity Advisor for Tearfund. I'm joining this from DRC in Goma. Luke, can you introduce yourself?
Sure, thanks. Hi, everybody. My name is Luke Martin. I work with Uwezo at Tearfund in our gender and protection team. I also work on gender-based violence issues, and both of us particularly work on transforming masculinities, which is what we'll talk about today.
Great.
Shall I carry on, Uwezo, to start?
Yes, please.
Great, thanks. I'm going to share my screen now, so please let me know if you can see this. Can people see this?
Yeah.
Great, thank you. So transforming masculinities is Tearfund's primary approach to ending sexual and gender-based violence through promotion of gender equality with faith communities. Very briefly, just to note, transforming masculinities is the name we use for the global program, but in different contexts, it might have a slightly different name. But transforming masculinities, or TM, is the approach that we're talking about today. So today's agenda, we are going to be doing this in two parts. The first part is looking at our journey towards developing this approach, why it's needed, what the approach is, the core elements of it, as well as looking at the core principles, the things that underpin and lead the intervention. We'll then take a short time to take some question and answers to make sure that we're really clear on the process, the approach of transforming masculinities. Then in part two, we will look at some adaptations of transforming masculinities. Transforming masculinities have been adapted as well as contextualized into many different key focus areas in a number of countries. So we'll give a couple of examples and also look at some of the key evidence in reviewing transforming masculinities. We'll look at the challenges and the learnings, and then we'll also take question and answer on the achievements, the evidence, and the key learnings. So that's the agenda for this session. So firstly, Tearfund's journey. How do we develop the transforming masculinities approach? As I'm sure all of you are familiar with, approaches don't come out of nowhere. They all have a starting point. And for us, that was working on HIV issues. And so Tearfund was doing a lot of work around HIV, but we realized that we can't do work around HIV without also addressing sexual and gender-based violence. That was coming through quite clearly in our work in HIV. So in 2010, we conducted a piece of research looking at the role of faith in ending sexual and gender-based violence. I should have mentioned that Tearfund is an evangelical Christian organization, and so in almost all of our work, we work very closely with the church and sometimes other faith groups too. So we were looking to hear the voice of survivors, to better understand their experiences and their needs. And they were telling us that they wanted faith communities to be safe spaces where sexual and gender-based violence would be addressed rather than covered up. We conducted some more research in 2013, which helped to refine our understanding. And we focused on the prevention and response to SGBV. What are the specific things that we need to be doing as people of faith to end sexual and gender-based violence, especially looking at the role of men in these contexts. From that, in 2014 to 2015, the initial toolkit, the core toolkit, was developed and piloted. So this is still used today with some tweaks. And then from 2015 to now, Transforming Masculinities has been piloted and tested in all of the regions that we work. So that includes 3 regions in Africa, Asia, Eurasia, North Africa, and Latin America. And in those contexts, it has been adapted to work more appropriately to those contexts. So why is Transforming Masculinities needed? Why is this such a focus for Tearfund and for our work? Well, we understand that in every community around the world, there's violence happening, particularly against women and girls. There's nobody that is immune, regardless of where they live. We understand that violence is primarily perpetrated by men against women. And that's why we focus on transforming masculine identities and any harmful masculine identities. We understand that violence doesn't happen somewhere else, but it happens close to us, in our own families, and for faith people in our churches and other faith institutions. We know that rates of violence are very similar for Christians as well as the rest of the world, and there needs to be a faith-based response. We understand that harmful social norms uphold sexual and gender-based violence. So social norms are those perceptions that we have, our understanding of other people. What do I think other people approve of, and what do I think other people are doing? There's a need for discussions and for reference groups, key influential people like faith leaders, to begin to speak out against sexual and gender-based violence in order for the social norms to shift to become more positive. We also know that gender equality is not in line with our faith. For the Christian faith, we understand that God created men and women with complete equal value, but this is not always believed by Christians. So it's important for us to look at the Bible for our key reference to reimagine what the world can look like with equal value of men and women. We understand that there is a need to engage with men and boys as a result of that research that I spoke about. As I said, there's a need to challenge harmful interpretation of the Bible and of scriptures. This is a really important aspect for people of faith, and it's one that cannot be ignored. Transforming Masculinities keeps the Bible and our religious beliefs really close to the core of this intervention. We need to engage with men and women holistically. We need to engage on all aspects of their lives, not just one aspect or another. We need to understand the context that they live in and what's important to them. Who are they listening to, and who are they looking to model their lives on. We also understand that gender inequality, unequal power, these are the key things that need to change. And this is a key aspect of the approach that we'll talk about. And finally, whilst faith leaders and faith communities can play a harmful role, we also know and are convinced that they can play a very, very positive role in shifting harmful social norms and ending sexual and gender-based violence. I will now, one more. So the three core elements of the problem that we're looking at before we look at the approach itself. Firstly, it's inequitable gender norms. So these norms which value men higher than women. We believe that this allows a really high prevalence of sexual and gender-based violence. Another problem is the harmful practices, harmful ways of being men or women that cause harm. And then finally, that faith communities and faith leaders have historically and still do play a role in reinforcing these harmful norms and practices, but they don't need to. This can change. So I'll pass to Uwezo now, who will talk us through what the approach is in response to those needs.
Yeah, thank you, Luke, for this great introduction. Can I ask people who joined with, for example, my name, because we shared the link, but when you come, it comes with my, when you join the meeting, it comes with my name. If you can manage to change just the name, that will be appreciated. So now, what is transforming masculinity? As Luke said, we work mostly with faith communities, and it's a faith-based norm shifting intervention. And we have found, according to some research conducted, social norms are, considered as a driven factor which can contribute to the SGBV, and we are trying to work on these norms, as it's known that when there is inequality in the way people are living, it can contribute to SGBV. And it was designed to end sexual and gender-based violence and promoting the gender equality. These are the main focus for this approach. And the aim is to challenge harmful social norm in order to promote the positive way of being a man or a woman. And it uses a balance of scriptural reflection with participatory activities. It means we are trying to bring people back in their context so that they can apply the knowledge according to the reality they are living in. And the focus on the main topics are around gender equality, gender norms and roles, the power imbalance, how the relationships look like in the community. And to achieve all this, we need to have a personal commitment and the willingness to change or to reflect on the process for all people who are involved in the program. It means, for example, those who will be trained as actor on the front line should be commit themselves to this change and accept, the change which is coming in. And yeah, it's an evidence-based because we had to refer to many contexts. We are not replicating the same thing. We are trying to contextualize or to adapt the approach to different contexts, and the transforming masculinity has been rigorously evaluated in multiple contexts. So yeah, according to some good findings, and we'll share some results in the second part of this presentation, you will see the shifting we have seen in different contexts. Next slide. Yeah, there are key components. The main key component, we start with the leadership. The leadership is very key for this approach because we are convinced that leaders can play a key role in leading on the change we want to bring in the community. And for that reason, the faith leaders can be at church level or at mosque level, need to be trained, need to be equipped, and so that they can, deal with difficult questions around the topic, and also they can support other actors, those we call gender champions, but themselves can be the model in the community they can play this role model, and people can, start learning from them how they should behave, how they should live in the community in terms of avoiding all fighting this issue of SGBV. And the other component, which is very, very key, it's the gender champions. Gender champions are kind of community activists who will facilitate community dialogues at community level or at church level. And they need also to be trained. But also they have another role to diffuse messages, to organize diffusing activity, to diffuse messages in the community or at church level. And the activities, the main activity they organize are called the community dialogues, is where they will bring people in small group to reflect, based on some guidelines, materials we will give them. And also we have the last key component, which is the diffusion of activities. As you can see, activities are happening at different levels. Some are happening at church level, but some are happening also at community level. And we need, when designing a proposal, make sure that we have activities which will be organized at different level and how they can be diffused, so that we need to reach everyone in the community, some from churches and some from local communities. Next slide. Yeah, the transforming masculinity, as you have said, has about key components, but also we have the main phase, which are 4. We have also 4 main phases. The phase 1 is the transforming of a leadership. Yeah, for this program or for this approach, it's not about being trained and start doing things, but we want also the leadership to be transformed, the leadership to be convinced, the leadership to take on the responsibility. And this is why we start with them. When they are trained, and they can also support, or they can give support to gender champions when some activities are happening at church level or at community level. And this leadership, after being trained, it's great to think about their refreshment, so that they can be updated on things, and also they can have time to discuss, to share what is happening in the community. This is the phase 1. The second phase, it's about equipping gender champions. The gender champions are trained using the Transform Masculinity Manual. And after that, they will be also recruited. Gender champions have to recruit, participants, for example, who will attend the community dialogue sessions. And to select gender champions, we are helped by faith leaders. We are helped by the leadership, who will identify people according to the criteria we share with them during their training, so that they can help us to select people who may be, qualified as gender champions. And these gender champions will be also trained. But also, as I said, for them also, we need to think about refresher training. And this is the second phase. The third phase, next slide, please. Yeah, the third case is about facilitating community dialogues. The community dialogues, as you can see on the screen, it's organized in a kind of a cycle. It means we can start, some sessions, and after after following or finished with the sessions planned for the cycle, then we can start again a new cycle. And these community dialogues are led or conducted or facilitated by gender champions. So gender champions have about 2 weeks for the standard model to plan, to recruit, and also to debrief about the process. Then the sessions will be facilitated for about 6 weeks. And each week we have 1 session for 2 hours. But for the 5th week, the first 5th week, people will be meeting in separate groups. And the last week, they come together in a mixed group to discuss and to share what have been learned during the 5 previous sessions. The last phase, which is the phase 4, it's about diffusing messages. And this it can be done by sermon, by faith leaders, or it can be sharing of testimony and stories by community dialogue participants, those who attended the community dialogues, or during the celebration, because you organize also the event to celebrate the change people have observed, and people can share some testimony also during this event. Next. Yeah, so the theory of change for the transforming masculinity, it has about, 3 spheres. We have the sphere of control, is where, mostly it's the intervention we do in the community, and we train actors, faith leaders, we train gender champions, and the primary audience we have, which are male and female at community level or at church level, and the secondary audience, it can be the wide community. So, but the main actors need to be trained are the faith leaders and gender champions. And according to some adaptation we made, we can add also another category of actors who are the community action groups. These are the the sphere of control, because we are the one working on this sphere. And the second sphere, next slide. The second sphere, which is the sphere of influence, and it's where we have this kind of the intermediate outcomes. It's about the attitude, the supportive, normative environment, and the skills. We want to see, the change, the kind of change we want to see starting at community level after engaging with the sphere of control. Then we want to see some change, some influence, and we want to influence the attitude. For example, we want to see the kind of gender equitable attitude happening in the community, and the rejection of SGBV. It means people are not accepting SGBV. When someone is raped or when someone is abused, all the community should stand and say, this is not something we can, agree with. We need to speak against, and everyone should consider this as part of his responsibility. But also the support for survivors. This is also something we want to see. People have changed attitude. As you can see on the screen, there are many, many things we would like to influence, and we would like to see people, have start a change. And the last sphere is the sphere of interest, where we would like to see the behavior of people changing. For example, the improved relationship, for example, at household level, the way women and men are treated each other. This could be something showing the relationship have been improved. And also we want to increase the couple communication and shared decision making, because we have seen that, in most of communities, when it's time to make decisions, sometimes women, or most of the time, women are left behind, are not participating. And we would like to see things like that changed. And even the reduction of intimate partner violence is something we want to see. And also we want to see the inclusion of the increase in supporting survivor. But the impact, it's about men and women. We want to see that men and women are experiencing more equitable, violence-free relationships. This is really the impact we would like to see. And this is how the theory of change for this transforming masculinity approach is look like. Next slide. Yeah, the community dialogues, as I said, it's the way activities are organized by gender champions. This is, the sessions are facilitated by gender champions. We have manual they refer to during the facilitation. And the session, as I said, is 2 hours per session for 6 weeks. This is the standard model. We have some adaptation we made, and you will see that late. We can have more than 6 sessions, but for the standard model, it's about 6 weeks. And as I said, they are organized in single sex groups for the first 5 weeks. The last week, it become a combined group where we'll have both men and women together. The group size for participants in these community dialogues are, the maximum is 10 people per group, and the minimum it's about 8, because we want to see they accountable to each other, but also the participation level to be more active. And also the language should be developed according to the target. When it's with men, it's easy. They have their way of speaking about things. Even the challenge they faced are maybe different from what women are facing, so that it's easy to discuss such things when they are in separate groups. The organic and organized by gender champions and the members. But it's very important to make sure that participants who have started the community dialogue will attend all the session. And according to experience, we have seen that the rotation was about 80% and more. And this is very important during the recruitment to make sure that those who are coming to community dialogues will commit to attend all the 6 sessions. As you can see here on the screen, there is the cycle here. I think I have explained this before. I said we have about 2 weeks for break, for plan, for recruitment, but also for debrief. Then we have 5 weeks for community dialogue in single sex group. And the last week, or the 6th one, it will be the combined groups where we have both men and women. Next slide. Yeah, this is how look like the sessions. These are the main topics, but under this topic, we have many other subtopics in which we can talk about different things. But for the first week, it's about introduction to SGBV and root causes. The second week, it's about gender roles and norms in daily life. The third week, it's about power, status, and SGBV. The 4th week, it's about faith and SGBV. Remember that we are working in a faith community, and we want to contextualize this to the faith we are working in. The 5th week, it's about moving forward. And from this week, after this week, then people will come in the combined sex groups where we talk about looking ahead, envisioning a community free of SGBV. Next. Yeah, we have different materials. These are the standard manual we used. This one, the green one here, is the main for the training, the Transforming Masculinity manual. Is this manual we are referring to when training people. The community dialogue manual here is what gender champions are using to facilitate community dialogues. It's well structured. We have questions people should ask, material needed for each session when preparing the community dialogue. The hand in hand, it's a book with sexual violence Bible studies. And within this manual, we have also some Quranic verses, and we have also some adapted manual to Quran to Quran context. But also the implementation guide, this is mainly for people who would like to implement the program. You can see the different steps in terms of designing program, what tool you need, and so on. For example, how to prepare the workshop and everything. You can see them in this implementation guide, which will be maybe accessible to you after this webinar. Next. Yeah, Transform Masculinity overview, we have some core principles. As we said before, we want to challenge harmful social and gender norms and focusing on gender inequality, power hierarchy, and root causes of SGBV. And also, it's about a mobilization, community mobilization process. And it's structured. You need to follow the different steps it's developed for this approach, but it's also an experience in learning. It's an interactive and practical move away from theoretical discussion. We don't like to say things from manuals, but we want to contextualize. We want people to share what is happening and try to contextualize, the topic or the sessions. So, and accountable practice is very, very important for people who are involved in this approach. And this should be placed at 2 levels, at personal level, but also at a relational level and at other level too. Next. Next slide. Yeah. The sessions or dialogues are framed around the key scriptures that influence norms and practice. This is very important because it's about shifting harmful norms or changing harmful norms. And the scriptures we refer to are about norms, are about gender, the way people can interpret gender, the way people can, internalize things according to their context. And you want them to reflect, just why you talk about dialogues. It's not about teaching, it's about people to reflect on what is happening in their community, and they can make a right decision according to what they understand. But this is led by someone who have been trained, and it should be prepared of where you want to reach. And it's an interfaith. We have seen that also because we have worked in different contexts where we can have Christian alone, but in other contexts, we worked with, for example, Muslim and Christian. So it's an interfaith approach. It can bring, different faith community together, but also it's promoting a social cohesion. In some contexts, faith, they are not working even together. But when you come with this approach, it contributes to the social cohesion. And it's working in collaboration where needed and appropriate. So it's also a group learning and a safe space for dialogues for both men and women. But we need to learn continuously and make sure that during the implementation, we are getting feedback so that we can improve or we can contextualize or adapt according to what the community members are giving as feedback. Next slide. Next slide, Luke. Yes. So we had some adaptation and we received some funding from different donors. As you can see here, we have received key institutional funding. For example, we have received from UKID, the FGDO for now, from USAID and from Templeton Foundation, from Conflict and Humanitarian. This was from DRA, and the other one was from Livingstone. So, and there are some key thematic and geography adaptation we made. For example, in Sierra Leone, Chad, and Mali, we have adapted the transforming masculinity, focusing more on the female genital mutilation and cutting, but also the early child marriage. In Central Africa Republic, we adapted the approach to the women's economic empowerment. In DRC, it was on family planning. In Nigeria, it was on family planning and interfaith social cohesion. In some place, even again here in DRC, we have worked in a conflict affected or a humanitarian context, and in Iraq, this was under a project funded by the Dutch Relief Alliance. In Central Asia, we worked with a non-faith focus. We tried to adapt the approach to work with a non-faith community. It means the entry point was not at church or at a mosque, it was in the community. And also in Latin America, worked with church mobilization. In Jordan, with Syrian and Iraq refugees, we worked with refugee population, and this was funded by Livingstone. Next slide. Yeah, I think this is the end for the first part. There are some questions. I think we can discuss. If someone has a question, please.
So there are a number of questions in the chat, Uwezo.
Yes, please.
Let me see. So one of the questions is, how are the gender champions nominated?
Mm-hmm.
And then
can you answer? You want to put all the questions and we'll come.
Sure.
Okay.
So one of them is about how the gender champions are nominated. Another one is somebody's asking if you could elaborate the meaning of moving forward and looking ahead, and what are the differences between these phases. And then there's another question about the facilitators and how they're trained and identified.
I think this one look like the first, how gender champions are nominated. Yeah.
Yeah. Mm-hmm. But not only, yeah, and then how they're trained to actually facilitate the dialogues. And then another question is about some examples during the discussion diffusions. What are some examples of the most common unhealthy masculinities that need to be diffused?
Say it again. What
are some of the most common examples of unhealthy masculinities that need to be diffused?
Mm-hmm.
And then one more about the measures for the program for capturing and understanding attitudinal and behavioral changes amongst participants. And my gosh, there's so many. There's a few more.
Should we begin to answer a few of those? I don't know, Uwezo, if you want to go first or not. I'd quite like to just answer that question about diffusion.
Okay. You can go.
Yeah, it might be helpful just to clarify that diffusion stage. So what we mean by diffusion is sharing messages wider than just the church. So this primarily, the intervention is primarily done within the church. So the community dialogues, they're with church members or faith group members, if it's another faith. Sermons are preached by faith leaders. So the primary intervention is done with the faith community. When we say diffusion, what we mean is we are not just interested in the church or faith community, we're also interested in the wider community. So diffusion means taking the messages and sharing them with the whole community. So this could be things like doing a talk at a sports event or different cultural events that are in the community, and that will really vary. But the important thing is that we're diffusing messaging into the wider community. In terms of that question there, I think it was asking about what norms need to be addressed. That's a really helpful question. Typically, there are very common norms that we see, things like it's okay for men to discipline wives with physical violence when they do things wrong. That's something we often see. However, in every community, the norms will be different. And we worked with the Institute for Reproductive Health at Georgetown to develop a tool to help understand what norms are in communities. So whenever we work in a new context, we would run that particular tool, and it doesn't take very long, just a few days. And that answers the question that you asked. And it shows what norms exist, what are the harmful norms that are there. So I hope that's helpful to that question. And Uwezo, you might want to pick up.
Great. Thanks, Luke. Someone asked about how gender champions are nominated, and I think, yeah, if I can combine it with another one, how they are trained. So as you have seen, maybe we have tool we refer to during the training. For example, we have the Transforming Masculinity manual, which has different agenda. It means they are trained and they follow it. For example, gender champions are trained for 4 days. Faith leaders are trained for 3 days. And what makes difference between faith leaders and gender champions, it's because gender champions have to facilitate some dialogues, and this is why we have more days for them. And yeah, we have a topic already well developed, and for each category of people, we have a manual and we have something we are referring to. In terms of recruitment, as I said, we start with faith leaders. They are first to be trained. And during the trainings, we have the criteria, because we are not the one influencing in the recruitment of faith leaders. It means when we come in the community, we will target local churches, local mosques, and we'll go to talk to leaders who are there and explain, why we are coming to see them. And if they are interested, then they will participate in the program. And after following the training for 3 days and understanding the burden of the work, even the problem itself, and during this training, we'll share the criteria. We have the criteria with them. For example, it must be someone who is living in the community for a long period. It must someone who is known as, because in community, we have people who are known as champion in gender, but who are interested in this kind of work. And someone who have not been said, he's never been a perpetrator in the community living in. So there are different criteria we are trying to share with them. And after that, they are now trained to become gender champions or to become a facilitator for this. But it's important, as I said during the presentations, the commitment for them to the transformation is very, very important. It means during this process of training and of working in community, we are asking them, we are following them, we are trying to monitor their behavior so that they will start behaving according to what they are teaching in the community. There was another question. It's about how are we capturing the change, among participants? Yeah, we have a tool. we have tool, and faith leaders, not faith leaders, gender champions, when they are organizing, for example, community dialogues, even faith leaders, we have staff who are working in collaboration with them. They are not working alone. We have some people who are there following what is happening. And in case, for example, they need support, this project staff will come and help them. But in terms of collecting testimonies or taking some success stories, this is done by those who are at the front line, like gender champions and faith leaders. So, but after a time, we have to organize kind of studies, kind of survey to take some changes to measure some changes which are happening. And this is according to the researcher, we can involve people who participated in the activities, and if they're able to share something, and we'll share some case studies after this first part of the presentation, where we will see how we collect data and what changes we have seen. Someone asked about the phases, I think. Yeah, as I said, we had 4 phases for the transforming masculinity. The first phase, it's about transforming leadership, the leadership. And this is very, very important because, as we said, we want the leadership, it can be at church level or at community level, to take the responsibility to make this, because also there is another aspect behind that, it's the sustainability of the program. For example, at church level, when the faith leader is involved in this program, it's easier for him, to integrate the program in the church. And they are trained. After being trained, they will be equipped with materials, but they will help also in gender champion selection from the community. This is the first phase. The second phase, it's about equipping of training those people who were selected as gender champions. This also will be trained. They'll be equipped with materials to start before they are sent in the community to conduct the community dialogue sessions. And they are recruited. We have to recruit men and women. And this is the phase second. The phase 3, it's about the facilitation of community dialogues, as you can see on the screen. And this is, I think I've explained, the dialogue or the community dialogues are facilitated by gender champions using the community dialogue facilitator guide, the one we shared earlier. And the sessions will be organized for about six weeks, and the participants are 8 to 10 for each gender champions. And the group of men will be facilitated by a male champion, and the group of women will be facilitated by a women champion. And this for 6 weeks, but the 6 weeks are divided. The 5 weeks, people are working in separate groups, in a single sex group. And the last week, they come together. After that, they will have a kind of debrief. Gender champions will share about what happened, and faith leaders can be invited with even the staff project to understand, to consider some challenges they face and give some advice on how they can address those challenges. And the cycle will end there. Then they can start again to plan a new cycle, and this can be organized, for several times according to the timeline we have for the project. The last phase, which is diffusing messages, I think Luke tried to explain this. It's about activities in which we will diffuse message in the wider community. It can be during sermon, for example, for faith leaders. It can be, for example, sharing testimonies or celebratory events. This following each cycle, because after each cycle, we have to organize this kind of event for people to share or to celebrate the change they have seen, and also how they will plan to move forward. So I think these are the main questions I took. If there are some, please let us know.
There are a couple that I saw, but I think you're right, we should move on in a minute. But just briefly, there's a question that's come up a number of times, and that's where the resources are available. The resources are available freely on Tearfund's website, which we'll share at the end of this. And I think somebody has already shared that, so thank you. The only thing to say about that is that the resources are available, but from our experience, it's much more effective when we work in partnership, and that will look different every time. But in every circumstance, we always strongly recommend that Tearfund provides a first training at the very minimum in the approach. And we found that that can be very helpful, and it avoids any problems coming up. And secondly, a question that's come up a number of times is about different faith communities. As we've mentioned, Tearfund is a Christian organization, but of course we do work with other faiths in certain contexts. Uwezo mentioned, for example, in Nigeria, there's a project where we worked equally with Christians and Muslims, and we added a component on peace building and social cohesion, because there was lots of conflict with Christians and Muslims. And we saw really great results where not only did sexual and gender-based violence decrease, but also there was increased social cohesion. So that is a challenge for Tearfund, because our primary work is through the church, but we've got some really great experience that we were really pleased with. The final question, Uwezo, I think I'd pass to you before we head on to the next part of this. There was a question saying, how do you make sure that these are not just Western ideas being taught to people around the world? How do you make sure that these are values part of the community? Would you like to answer that question, Uwezo?
Thank you so much. Yeah, this is part of the community, simply because around the world, you know, everyone has a faith in which you are affiliated. And if we manage to use this approach, you know, evolving the faith, using this as a driven space where we can reach everyone in the community. Remember, there are people we can reach, you know, through faith, but we can't reach them in, you know, community activity. And this is very important, because when they will see the leadership in church and the place the faith leaders have in the community, in the society, is very important. And if we manage, you know, to change their perspective on how SGBV can happen, for example, in a faith community, and if the faith leaders can take the responsibility on this issue, start, you know, yeah, someone asked, you missed my question, challenges. Yeah, maybe you will remind that question later. So I wanted just to say faith is very important in terms of reaching people easily, but also the confidence given to people at faith space is very important. And we can change, you know, even the perspective. There are some faith leaders who used, you know, for example, scriptures in a wrong way, because they misunderstood what does it mean. So we are trying to give a background on all these things, and yeah, it can contribute very much, and it can add value to the fighting against SGBV in the whole society. Yeah. So yeah, there is a last question here. I don't know if it's possible to see. Let me look. Challenges around initiative, sustain gender champions involvement. Yeah, this is one of the challenge. Maybe later on we'll come back to it, and you will see the challenge we have faced. And yeah, I think please allow us to continue the presentation, because some questions may be answered after the presentations, where we faced some challenges, some learning lesson, and other things. You will find them in the following part of the presentation. Next. Yeah. So for this second part of the presentation, we share about 2 case studies where we had some evidences of the work we did using the transforming masculinity. And the first one, it will be about the what works to prevent violence against women and girls. This project was implemented in DRC during the first phase of what works, and it was funded by the FGDO. The second case study, it's about masculinity, family, and faith. It's the standard model of transforming masculinity, but we added on this, it's an adaptation where we added the family planning. And this program was implemented in DRC, but we scaled it to Rwanda. Next. Yeah, the first study, for example, the World Works to Prevent Violence. And this is about, some change. We will share some indicators or some shifting we have seen during the implementation. For example, from tolerance to resilience, where we saw a number of attitude to intimate partner violence reversed. For example, during the baseline, the study we conducted, we realized that, for example, physical violence was justified. And for people, it was right, especially for men, it was accepted. And the percentage was about 71%. But after 3 years of intervention, we realized that this number, this percentage changed or shifted from 71 to 55%. And which is a good number, good shifting in terms of reduction, in terms of tolerance or to resilience. And again, to the same indicator, for example, here, women are not allowed to refuse sex, because we have realized that in this community we worked in, women, for example, were abused because they refused to have sex. And we have seen also the shifting, it was from 80% to 55%. And this was among men, the men who said that. For women, we realized that women at the beginning accepted, for example, violence at 53%. But after the intervention, it changed to 38%. And for male superiority to gender equality, and we try to develop a kind of alternative pattern of masculinity for men, but also for women. We wanted to see how men and how women are seeing this, the equality for among them. And the men, at the beginning, they said 90% of men said they were superior to women when we conducted the baseline. After the intervention, we realized that the number shifted to 70%. And we gained a kind of 20% who realized that, who said God created men and women equally. Yeah, the women, same thing, said, for example, at the beginning, 90% of women said women's primary role is family care and cooking. So which means, the community, the entire community, reduced women to cook or to take care of the family. But after the intervention, at least there was a change about 20%. Now, from violence to non-violent response, we realized that there was a significant reduction in intimate partner violence and non-partner sexual violence. The intimate partner sexual violence for men shifted from 68% to 24%. And among women from 69 to 29%, which is huge, shifting. And for non-partner violence for men, for women, it shifted from 21 to 4%. From the stigma to support survivors, for example, survivor internal stigma reduced, and as did external stigmatizing attitude. So on rape myth beliefs, for example, there was a big change in terms of the myth, the belief. Someone when was, for example, raped, people had different belief about this. Maybe this person is a devil one, things like that. But after the intervention, people changed their belief around SGBV, around people who have been raped, for example, who have been abused. And the IPV survivor seeking assistance, was increased from 2% to 40%. And according to 74% of respondents, faith institutions supported survivors. This is why, you saw the shifting from people who seek for support from faith leaders, because they realized that church leaders oh, faith community is a space where I can go for support. And according to that, seeing the faith leaders are working on SGBV, most of survivors were disclosed to them and they come to seek support in this space. And we realized that from silent witnesses to vocal champions, 83% of participated in a public talk or discussion on violence against women and girls, which is a huge percentage in terms of attendance at community level. These studies were organized at community level. As I said at the beginning, in one of when I answered one of the question, using the faith space as an entry point, it helped very, very much to reach more people, to reach a huge number of people in the community. And according to the result here, because this was conducted not only at church level, but in community, we realized that about 83% of people participated in the activity, and 64 of them, accessed couple counseling because they went to faith community, faith leaders asking for support. Next. Yeah, this is about the first case study, and we engaged about 70. Hello? Okay, we engaged about 75 faith leaders, 30 general champions, and about 225 community action group members. It was about 15 community action group members, but in each community action group, we have about 15 people who are members of this community action group. And the representation of gender balance was 50-50. We had about 50% of women and 50% of men. And these people were trained and equipped. And most of the topics we discussed with them was about violence against women root causes and theology, gender equality, but how to support survivors, but the basic counseling and mediation. And there were also some community-led actions, the role models, information sharing at community during the community dialogue sessions, but also the support given to survivors. And we had also a key component of this program, it's the monitoring and the mentoring. These people who are working at community level need to be mentored, but also to monitor what is happening. This is why we need to have project staff who will be based in the community and can participate in different activity, can follow what is happening in the community. And also the research or to gather some evidences, it's very, very important to inform the intervention. Now I can hand over to Luke.
Sure. Thanks, Uwezo. Yes, really helpful. Thank you. And to clarify, we describe transforming masculinities as evidence-based, and we say that from the research that has come out of the partnerships with universities that we have had, so under what works that Uwezo described, and also this next intervention or adaptation. So our evidence comes from that high caliber research, and then in each of the interventions we run normal monitoring evaluation with baseline and end lines, but this data comes from that higher caliber research, which reports are on our website as well for those who are interested in perhaps the methodologies or the deeper findings. So this second intervention or second adaptation, Masculinities, Famille et Foi, or Masculinities, Family and Faith, this uses the very same model of transforming masculinities, but it includes a component on family planning. So in addition to the typical aspects, so faith leaders, gender champions, community dialogues, and diffusion, we included family planning reflections in the community dialogues, as well as strengthening the family planning service environment. And this was done in partnership with the Institute for Reproductive Health. So there was youth-friendly training in service providers. There were referral cards to encourage uptake, and a hotline, a phone line that was used for reproductive health questions and queries. And the target groups were largely the same, but a specific criteria was added that in this intervention, we were specifically working to support newly married couples and first-time parents, as well as wider congregations and communities. So in addition to those normal problems that we have been addressing with transforming masculinities, we noticed that there is constrained family planning use and support for early marriage. There's also partner absence in decision-making around family planning and involvement in that. And there's a perceived or real opposition to family planning from faith groups and faith leaders, and limited evidence around that as well. So, as I mentioned, we added discussion on family planning. So you can see that the core community dialogue remained the same, but for an additional number of weeks, week 7 and week 8, there were discussions specifically about family planning. And these are not just information, although there was information. This was building on the conversation and discussion from the previous weeks. So it's talking about family planning in the context of shared decision-making, shared power, and equality. So I'm going to share a few results now. I'm going to start with a few on family planning, but also talk about some on other indicators like intimate partner violence. So you can see, and I'll describe this because it's not particularly clear. So you can see that those who are in the congregations were more likely to report currently using modern family planning compared to those who were not in intervention communities. They were more likely to report intending to use a modern form, even if they weren't using it right now. In terms of self-efficacy, congregation members in these congregations were more confident that they could use it if they wanted to, compared to those who were not in these intervention congregations. And they were also more likely to be confident that they could talk to their partner and suggest using modern family planning compared to those who were not in these congregations. The reason I wanted to share these particular statistics or findings with you is we were really encouraged that by adding on a component, we could address other issues, not only gender equality and sexual and gender-based violence, but also related issues, such as low uptake of family planning. Now, significantly, there's a question around whether adding a component would reduce the effectiveness of the core aim, which is to reduce sexual and gender-based violence and promote equality. Now, the results that we had were very encouraging.
Donc, c'est à vous de gérer. Donc, ne dites pas que vous avez déjà fait. C'est ça le problème principal.
I'm just going to wait for a moment. Thank you. So also in terms of intimate partner violence, or IPV, congregation members in these communities were less likely to report experiencing intimate partner violence, or if they were a male, they were less likely to be reporting perpetrating violence compared to those in other congregations. Physical intimate partner violence didn't have a particularly big difference, although it did reduce over time. In terms of any forms of intimate partner violence, we didn't see any particularly statistically significant differences for newly married couples at Endline. However, first-time parents were less likely to be reporting intimate partner violence compared to those in other congregations. We're not exactly clear about the reasons for that, but it was interesting to note that the two different groups, newly married couples and first-time parents, had slightly different results there. One thing that was interesting to note was in terms of norms. We expected that the norms would shift So we expected that people's perceptions of other people's actions and beliefs, we believed that that would change before behavior. But what we actually saw is that behavior is changing ahead of norms. So norms did not particularly shift as much as we thought they would, but behaviors did change. So that was something for us to reflect on in terms of the theory of change. I'm going to pass to Uwezo now, who will talk us through some of the challenges.
Great, thanks, Luke. For this presentation, for this transform masculinity approach, we faced some challenges, and I think it's great for you to be aware of this when working with faith communities or with volunteers. So the main, one of the challenge, it was about people who are involved, especially at church level, who are not staff project or staff partner, are volunteers. And we have seen that some of them dropped out in the midway of implementation. So we need to train again more staff to have a number of people who want to cover or to do the activities at community level. This was one of the challenge. The other challenge is the absence of services, especially for survivors in the rural areas. You know, when we come with these honest messages around SGBV, around, you know, why it is important for them to be to be treated, for example, emotionally or I don't know, physically, things like that. In most of cases, in community or rural areas, there are no providers in terms of services to survivors. This was part of the challenge we faced. And the participants often make a disclosure sexual and gender-based violence. This was seen somewhere. So people who are involved in this program should be also trained on this ethical aspect so that they can keep confidence some informations they got from people who come and disclose their status. And the rural communities, there is lack of relevant services, as I said. And in humanitarian settings, I saw someone ask the question like that. You know, we have implemented this in a humanitarian setting here in DRC. And there was the problem because most of displaced people, their need is not, it's not about, their priority is not about messages around SGBV. They have other crucial needs like food, like, you know, things who will help them to survive physically, even if they are suffering by, you know, harmful norms which can be among them. So this was one of the things we've seen. And when survivor pursue justice, in some contexts, it's very, very risky for them because of the impunity. And when a perpetrator, you know, for example, have been called at justice and he's released by the justice, you know, this make life for survivors at risk. Yeah. The next, in community where we work, faith offers powerful opportunity of engagement and mobilization. I think we mentioned this when responding to one question. So faith leaders or faith community, it's really, really powerful in terms of bringing change. And they can also, they are providing also the opportunity of to sustain our intervention, to sustain the change in the community, because organizations are in a community for a short period, but local church, local mosques are there for a long period. And if they have integrated this approach in their program, it means it will remain the community for a long period. So they offer a great opportunity to engage all community members, but also to sustain our program. And the scriptures or the spiritual beliefs and faith leaders are key reference groups in the community. So they are also believable in the community. People can trust them. When a faith leader is talking, they are trusted easily than you know, another people in the community. So this is help us to shift or to change or to reinforce norms. around equality, to change norms around inequality. So faith-based approach is showing evidence of impact and need to be intentional to not to reinforce harmful gender norms. That's very important. When working with faith-based community or faith-based approach, you should be intentional how to address or to avoid how to address these harmful norms which are already known. And when giving some example, you should refer to those harmful norms which are already there, which are known. And faith leaders and communities are unequally positioned to engage men and women in SGBV prevention in most of context. So this is something also we have faced as key learning. Next. There are other key learnings here. To engage both men and women is very, very important because they are given equal power in giving on providing their voice. So they are heard the same way because we have 50% of men and 50% of women. It's preaching by example so that men and women are well represented. And yeah, the accompaniment of key actors is very, very important. As I said, we should, when designing the proposal, you should plan to have staff project who will be close to these community actors, making sure that program is well implemented, but also if they face challenges, they can refer to someone who will give them support. And generally staff and key actors think they are already doing well with gender issues. This is the common understanding of people. But for this approach, everyone should be engaged in this transformation process to make sure that we are committing, we are following what the approach is doing. So it's very important for staff, even community actors, to be accountable, to make sure that we are committing to what we are teaching in community level. And men, what we have realized that men are often conflict in understanding their roles. Here, when it's time to divide the roles in community, most of time, men are not fulfilling their roles. They leave them to women, and we have seen that women, are sometimes can be conflict, but not than men. And the women are more peaceful, so they find easily a way for peace. For example, they can ask for forgiveness easily than men. This is something you have seen, for example, in Myanmar. And addressing underlying causes of SGBV and taking social ecological approach is very, very important when designing the proposal. So it's possible to bring in many levels of intervention. For example, you can plan to work at individual level, at relationship level, at community level, but we can add in some activities which will be led to, for example, to those who are decision maker at community level, to try to influence decision at policy level. So that could help us to make sure that we are addressing the problem at different level, and the socio-ecological approach is very, very important when dealing with SGBV. Next. Yeah, other key learnings, as we said, the approach is flexible and can be contextualized or adapted to different contexts. So we have adapted this approach to many contexts, not only according to the social norms, but according also to the problem we want to address. Like what Luke presented here, if, for example, about if you want to address social norms around family planning, it was adapted to that area. I remember in Central African Republic, we adapted the approach to how women, can contribute to the income, and we try to empower them economically. So norms around women economic empowerment were added to the approach. So it can be adapted to the approach. It's not copy paste. It needs to be adapted to make sure that we are addressing the problem we have identified in the community. And following a pattern of scoping, piloting, testing, learning with an emphasis on putting people at the head of the initiative and exploring evidence is very, very critical to understand, but also the impact and the evidence we want to gather from the intervention. And evidence is more powerful when you implement academic institution. where we evolve them, it will be more powerful. Like the program, the two cases we have shared here. One was led by, the research was conducted by an external academic institution, the Stellenbosch University for South Africa, and the other one was conducted by the ERH is the Institute of Reproductive Health for Georgetown University in DC. So it's very, very important thinking about which people can conduct, which academic institution can conduct the research, and this will add value on the finding when sharing them. Next. Yeah, that's all for now. Maybe now we can now open the floor for questions. Mm-hmm. I don't know if there are questions.
Yeah, there are a number of questions in the chat if you'd like to have a look through.
Let me.
So one question was about working in humanitarian context or conflict contexts. Would you like to speak to that one, Uwezo?
Yeah, I saw that question. It's about, I think someone asked about how working with people who are displaced because they will not remain in the community for a long time. Yes, we had this experience, especially here in DRC. We worked in a community, we worked with both communities. We have worked with displaced people and the host communities. And it's where we realized that, the displaced communities had their needs, had their priorities. Yes, the SGBV is part of their problem, but they had other priorities, which was about food, about clothes, about, things like that. And yeah, we got to just because they were there for a long time, but it's a challenge because if they move from that location, it can affect the intervention. And we try to work with them and make sure that we are identified faith leaders, and we got some contact from these faith leaders in case they move from the location where they are. We would like to follow with them, asking how they are continuing the program in their community. And we try to train them several times to make sure that they had a good background in terms of training people so that when they can move, they will be able to start such program in their own community. But it can be a problem because we know when they are displaced, they need maybe to have more materials, and this material they will not. But as we had their contact, we thought reaching out to them after they are moving from the camp, it could help us to continue, keeping in touch. And in case they needed support from us, we could be able to give that support. That's how we managed to work with them. Unfortunately, this didn't happen because they were there during all the timeline of the project.
Sorry, there are also a number of questions about why did you choose to use the word family planning versus contraception? What do you mean by modern family planning? And then also questions linked to this is, what are the arguments to demonstrate that family planning is okay with religion? So you those could go together. And then another question, I'll give you one more. And then another one is about the experience of discussing LGBTQI within these projects.
Mm-hmm. Great. Yeah. The first question is about family planning and about the different methods. Maybe something we didn't mention, we work in partnership with a health provider. And when it's time to talk to different methods in family planning, they are also evolved. They come to explain the advantages of different family planning methods. And we had the different family planning method, and it's where the modern method come in, I think, if I'm correct. So there are some traditional method and there are, modern method. Modern method means we refer to, using external means, which are different to to traditional mean in terms of family planning. For example, using plant and other medicines to make sure that you have chosen at least one of the methods. So the method were just explained to people, and the choice was for each couple. It was not one person to make the decision for the couple. So we try to put in different method in collaboration with the health provider, and then participant to the community dialogues choose the method they are interested with. I don't know if I've answered. Yes, Luke?
Yeah, I think that's really helpful, and probably it's really worth adding that question about how do you ensure that family planning and religion, go hand in hand and they don't conflict.
Great.
Yeah.
You want me to answer?
If you'd like to.
Great. Yeah. What we have realized first, even among faith leaders, most of faith leaders thought that when you talk about family planning, it means you want people to stop, to be reproductive. That's what we realized. While family planning is not about that. Family planning, we try to explain faith leaders about what is family planning. Family planning is not about stop, giving birth to children. It's about when and how, you want to have children, and how many children you want to have. It's not about avoiding having children in a family, and people understood that. But at the beginning, it was really a challenge because they had this wrong understanding of what is family planning. Family planning is not about stopping people to have children or to give birth. This is how we try to manage, and it's about training. It's about sensitizing them for them to have a good understanding of what is family planning.
There are a lot of questions which I'll put an email for people to respond to, but there's one that I think is really important to respond to, and that's around accountability and survivors. And probably just to mention very briefly, and for those interested, we could follow up afterwards, but we are having discussions internally because actually it's very important for us to keep reflecting. We conducted research at the start of this, and we do work with survivors as we go, but that's a constant question to be working out for the intervention. And we have another intervention that's led by another colleague who's not here today, called Journey to Healing, which is specifically around survivor groups and healing. And in an ideal context, both of these work together so that there is a mechanism for ending violence, but there's also a very strong mechanism for support and for healing. That's not always possible due to finances or contexts, but that's something that we are very aware of, but still learning. But those resources are also on our website for those interested. There are a number of very good questions in the chat. So if it's okay, what I will do is I'll put in the email addresses that you can direct your questions to, and a link to our website where you can read a bit more about some of our work. I hope that's okay. Otherwise, if you have any particular question that you'd like to address specifically, then feel free.
Yeah, I think there was one question Bianca mentioned about LGBTQ. Yeah, so, SGBV, it's about human rights. Did the LGBTQ have a right? If yes, then, we should protect the human rights. And this is how we deal with such questions. And yeah, we agree that people may have different understanding around this, but us as Tearfund, it's about human rights, and we want to protect that. So okay. Bianca, I don't know.
Yes.
Yeah.
Thank you, Uwezo and Luke, and actually to all the participants for being so engaged. It's been such a wonderful session and such a great way to start this series within the CoLab. So as Luke has said, he has shared in the chat Uwezo's email and another colleague of theirs email. So for any questions that haven't been answered, you can reach out. And we apologize for running out of time and not being able to answer all the questions, but please do feel free to reach out. And of course, also the Tearfund website will have a lot of information and may be able to answer some of the questions that haven't been spoken to today. And on that note, unless there's any last things from Luke or Uwezo, I think we can end off for today. Again, a big thank you. Thank you to everyone for joining. Thank you to the interpreters for your great work as always. We will have the next session on, I think it's going to be June 8th. So do look out for information about that. And just again, to remind people, this is a peer learning session, which is an opportunity for members to share on their work at the moment around GBV and the impact of projects and lessons learned. So do look out for how to, if you'd like to submit something, how to submit a proposal for that. And as we will be running it once a month. So the next one will be in June, and then we'll have one in July, etc., etc. So we look forward to seeing you all again in the future. And thank you and goodbye, and take care and have a good rest of your day wherever you are. Thanks, everyone.
Thank you.
Bye.
Bye-bye.